In May 1943, when the Afrika Korps fell in Tunisia, roughly 275,000 Italian and German troops became prisoners of the Allied forces. What happened to the German medical personnel among these captives would prove extraordinary in the annals of warfare. They found themselves regarded not simply as enemy prisoners, but as professional colleagues in medicine. Historical documentation and authenticated testimonies reveal this remarkable chapter of military history. Special protections for captured medical staff had been codified in the 1929 Geneva Convention, provisions that would fundamentally define how these German physicians experienced their captivity under American control. Under the Convention's requirements, prisoners received equal treatment, which included payment at American military wage scales, with officers specifically protected from compulsory labor. Medical professionals enjoyed additional safeguards. They couldn't be ordered to perform work unrelated to medicine and maintained particular professional rights. As signatories to the Geneva Accords, the United States applied these standards thoroughly. What German medical officers encountered was an adherence to international legal standards that surpassed anything they'd known in their own armed forces. Transportation of German prisoners typically occurred on Liberty ships making their return voyages, which would have sailed empty otherwise. Monthly arrivals could reach 30,000 individuals, disembarking at Virginia or New York harbors before being allocated to various detention facilities. Generous treatment commenced immediately with ample food provided during the crossing. The voyage itself offered early evidence of American resources and prisoner management philosophy. Rather than the freight cars commonly employed for prisoner movement across Europe, German medical staff travelled in genuine passenger quarters with regular meal service, a logistical choice that nevertheless created significant psychological effects. As 1943 progressed, German captives were dispersed throughout numerous American detention centers. Texas received particularly large numbers, its climate considered comparable to North African conditions under Geneva requirements. Authorization came for 3 additional facilities that year: Fort Sam Houston in San Antonio, essentially a temporary encampment featuring 776 capacity tents housing both prisoners and American sentries, Camp Howze near Gainesville, and Camp Hood North at Killeen. Medical infrastructure varied across these locations, but generally exceeded German medical officers' anticipations. Facilities maintained infirmaries and sometimes extensive hospital complexes where German medical practitioners could work. Perhaps most remarkable was the professional acknowledgement German medical officers received from their American medical counterparts. Numerous instances occurred where captured German physicians treated American patients, while American doctors captured in Europe cared for German wounded. Generally speaking, physician prisoners received treatment as esteemed colleagues from their professional equivalents. One American physician documented how he and German doctors openly exchanged instruction on various medical techniques. The American Medical Corps typically extended identical care to wounded German captives as they provided to Allied casualties. This professional courtesy transcended mere symbolism. German physicians were addressed by their medical designations, consulted regarding medical situations, and incorporated into medical deliberations. Such treatment stood in sharp contrast to expectations formed by Nazi propaganda concerning American society. American POW camp medical facilities represented substantial investment in prisoner welfare. Camp Butner's Convalescent Hospital alone managed treatment for nearly 14,000 patients, offering not just rehabilitation but social adjustment programs, technical and exploratory instruction, vocational counseling, and general educational opportunities. By late November 1945, staff numbered 2,200, supported by 414 German prisoners, ensuring continuous attention for those recovering. These institutions served both American military members and POWs, establishing an integrated medical environment where German medical staff functioned alongside American colleagues. Equipment and supply quality in these facilities frequently surpassed what German military hospitals had possessed even prior to wartime destruction of German medical infrastructure. German POWs, medical personnel included, accessed educational programming that would have been extraordinary even for free civilians. Nearly every camp operated libraries stocked with donated publications and periodicals, some rivaling average secondary school collections. Camp Fannin, for instance, maintained well-supplied shelves holding over 2,500 volumes with circulation reaching 80%. For medical staff, this translated to access to contemporary medical literature and journals, resources that had become restricted or unavailable in Germany due to both wartime circumstances and Nazi suppression of non-Aryan medical research. Certain camps forged notable connections with American universities. An April 1945 report on Camp Butner documented 110 prisoners working as dining hall attendants at Duke University and UNC. Though these prisoners served in non-medical roles, the university affiliation provided German medical personnel at the camp with extraordinary access to American academic medicine. These university links, however limited, represented integration between enemy captives and American institutions that Nazi Germany would have found inconceivable. With millions of American soldiers deployed overseas, resulting labor shortages eventually led to German POWs contributing to the Allied war effort through work in canneries, mills, agricultural operations, and other minimal security locations. Medical personnel often found themselves in hospitals and medical facilities where their professional capabilities could be employed. German medical officers volunteering for medical duties received compensation corresponding to their rank and assignment, as Geneva Convention standards required. Though modest, this payment represented acknowledgement of their professional standing, profoundly affecting men who anticipated treatment as vanquished enemies. Growing German POW numbers presented different challenges. Initially, some nurses questioned whether they could set aside personal sentiments and deliver optimal care to these patients. Furthermore, official theatre hospital policy explicitly prioritized Allied casualty care over that provided to enemy prisoners. Most nurses, however, rapidly discovered they could view these men simply as patients requiring care, treating Germans identically to American soldiers. This professional integration occurred despite initial hesitations and official policies favoring Allied casualties. American medical personnel's ability to separate professional obligations from national hostility provided German medical officers with a model of medical ethics transcending political ideology. German medical practitioners in American camps observed medical supply abundance contradicting their experience of wartime scarcity. Fundamental medical supplies, bandages, surgical instruments, were available in quantities German military medicine hadn't seen since before the conflict. Pharmaceutical availability particularly impressed German medical staff. Sulfur drugs, carefully rationed in German military medicine, were employed liberally. Penicillin's introduction to some facilities by 1944 represented therapeutic capability that German medicine entirely lacked. Medical treatment provided to German POWs met or exceeded standards for American military personnel. German wounded received identical surgical procedures, medications, and rehabilitation services as American soldiers. This equality of treatment, mandated by Geneva Accords but frequently disregarded in practice by combatants, was consistently implemented in American facilities. German medical officers observed and participated in this equal treatment standard, acquiring experience with American medical protocols and ethical standards that would shape their post-war medical practice. Texas hosted numerous POW camps, creating a concentration of German prisoners, including medical personnel. Situated on approximately 40,000 acres spanning 63 square miles across Granville, Person and Durham counties, Camp Butner functioned as a combat infantry facility and training ground for an estimated 30,000 soldiers. German and Italian prisoners arrived at Camp Butner, where they served as cooks and performed various tasks. The magnitude of these facilities and their medical components gave German medical officers exposure to American military medicine at its most advanced. The contrast with increasingly desperate conditions in Germany grew starker as the war continued. Professional relationships developing between American and German medical personnel, though limited by the captor-prisoner dynamic, nonetheless included genuine professional exchange. American doctors learned trauma treatment approaches from German colleagues possessing extensive battlefield experience. German doctors learned about American progress in antibiotics, anesthesia, and surgical methods. These exchanges, documented in post-war testimonies and military records, represented significant knowledge transfer despite wartime constraints. The American medical system's less hierarchical organization surprised German medical officers accustomed to rigid military medical hierarchies. German personnel had to adapt to this different professional structure, an adjustment challenging their assumptions about medical practice organization. During the Second World War, Fort Sam Houston made space available for up to 1,000 German POWs. This arrangement commenced September 15, 1942, while dedicated POW camps underwent construction. Fort Sam Houston stands recognized as Army Medicine's home and the combat medic's home. Its role as a major medical training facility meant German medical personnel stationed there witnessed American military medical education and training methodologies. Though their participation remained limited, observing American medical training provided insights into alternative approaches to medical education. Dental care in POW camps, frequently neglected in historical narratives, provided another avenue for professional interaction. German dentists among the prisoners worked in camp dental facilities, maintaining oral health for thousands of prisoners. These dental officers experienced identical professional recognition as their medical colleagues. American investment in POW dental health, providing routine dental care rather than solely emergency extractions, demonstrated commitment to comprehensive prisoner welfare exceeding Geneva Convention requirements. German medical officers participated in public health initiatives within the camps, encompassing disease prevention, sanitation oversight, and health education. These activities exposed them to American public health approaches, emphasizing prevention over treatment, a philosophy contrasting with German military medicine's focus on battlefield trauma. These public health measures' success in maintaining camp health despite crowded conditions provided practical demonstrations of American preventive medicine effectiveness. The American approach to mental health treatment particularly affected German medical personnel. Combat fatigue, later termed PTSD, was recognized and treated as legitimate medical condition rather than cowardice or weakness, the prevailing view in German military medicine. German psychiatrists and psychologists among the POWs observed treatment methods including psychotherapy, occupational therapy, and pharmaceutical interventions. This comprehensive approach to mental health contrasted sharply with German military psychiatry's punitive approach to psychological casualties. As war concluded, German medical personnel faced repatriation to a devastated homeland. Many had spent 2 or more years in American custody, during which they'd practiced medicine under conditions often superior to what they'd known as free physicians in Germany. The repatriation process included medical examinations and health certifications conducted jointly by American and German medical personnel. This final professional collaboration reinforced collegial relationships developed during captivity. Following repatriation, approximately 5,000 Germans immigrated to the United States, with thousands more returning later to visit. Many farmers remembered their POW labourers with admiration and even fondness. Indeed, numerous farmers sustained warm friendships with them. Among these maintained relationships were professional connections between medical personnel. German medical officers returning to Germany brought knowledge of American medical practices, organizational methods, and ethical standards. While difficult to quantify, their influence on post-war German medicine was significant, particularly in areas such as medical ethics, patient rights, and professional standards. German medical personnel's exposure to American medical education methods influenced post-war German medical training. The emphasis on practical clinical experience, integration of basic science with clinical practice, and systematic approach to resident training were elements returning German medical officers advocated for in rebuilt German medical schools. Several German medical officers who experienced American captivity became prominent figures in post-war German medicine, though connecting their teaching methods directly to their POW experience remains historically challenging without access to personal papers and institutional records. The experience of German POW medical personnel in America is documented through various sources: official military records in the National Archives, International Red Cross inspection reports, post-war memoirs and oral histories, contemporary newspaper accounts, and camp newspapers published by POWs themselves. These sources, while providing valuable insights, leave many questions unanswered about the full extent of professional relationships and knowledge transfer that occurred. German pharmacists and pharmacologists among the POWs gained exposure to American pharmaceutical practice, including mass production techniques, quality control standards, and distribution systems. This knowledge proved valuable in rebuilding Germany's pharmaceutical industry after the war. Medication availability in American camps, from basic aspirin to advanced antibiotics, demonstrated production capabilities exceeding anything German pharmaceutical industry had achieved. This exposure to American pharmaceutical abundance influenced German medical personnel's understanding of what modern medicine could achieve with adequate resources. The exchange of surgical knowledge between American and German medical personnel represented one of the most practical aspects of their professional interaction. German surgeons, many with extensive battlefield experience, shared trauma treatment techniques developed through years of combat medicine. American surgeons shared advances in anesthesia, aseptic technique, and post-operative care. This bidirectional knowledge transfer, while limited by language barriers and security constraints, nonetheless enriched both medical communities. German medical technologists and laboratory specialists among the POWs worked in camp laboratories, conducting routine diagnostic tests and supporting camp medical operations. These personnel gained experience with American laboratory methods, equipment, and quality control standards, often exceeding German military medical laboratory capabilities. The systematic approach to laboratory medicine in American facilities, standardized procedures, regular equipment maintenance, comprehensive record-keeping, provided models for post-war German laboratory medicine development. German radiologists and X-ray technicians among the POWs operated equipment in camp medical facilities. American radiology equipment, particularly its reliability and image quality, impressed German personnel accustomed to maintaining deteriorating equipment with scarce replacement parts. Safety protocols in American radiology practice, including radiation protection measures for both patients and operators, exceeded German military medical standards. This exposure to radiation safety influenced post-war German radiology practice. The International Red Cross played a crucial mediating role in German POW medical personnel's experience. Red Cross inspections verified medical personnel received treatment according to Geneva Convention provisions, including professional recognition and appropriate work assignments. Red Cross packages supplemented medical supplies in some camps, though American military medical supply was generally adequate. More importantly, the Red Cross facilitated communication between German medical personnel and international medical communities, maintaining some connection to broader medical developments. Many POW camps published newspapers written by and for prisoners. These publications, subject to American censorship but generally allowed considerable freedom, included medical and health content written by German medical personnel. These articles covered health education, disease prevention, and medical news, providing German medical personnel with platforms to maintain their professional identity and share knowledge with fellow prisoners. The newspapers, preserved in various archives, provide insights into German medical personnel's perspectives on their experience. While limited, some German medical personnel were permitted to conduct medical research in American captivity. This research focused on non-sensitive topics such as nutritional deficiencies among POWs or disease patterns in camp populations, allowing German medical scientists to maintain their research skills. The ability to conduct even limited research with access to laboratory facilities and statistical support exceeded what many German medical researchers had available in wartime Germany's deteriorating research infrastructure. Disease outbreaks in POW camps required coordinated medical responses, bringing American and German medical personnel together in urgent collaboration. These epidemic responses, whether influenza, gastrointestinal infections, or other communicable diseases, demonstrated American epidemic control methods and public health responses. German medical personnel participated in these responses, gaining practical experience in epidemic investigation, containment measures, and mass treatment protocols that would prove valuable in post-war Germany's challenging public health environment. German medical officers observed American medical supply management systems ensuring consistent availability of medical materials. The systematic approach to inventory management, emergency stockpiles, and distribution networks provided models for efficient medical logistics. This exposure to American medical supply chain management influenced German medical officers' understanding of how modern medical systems could maintain consistent supply even under challenging conditions, knowledge particularly relevant for rebuilding Germany's destroyed medical infrastructure. Treatment of combat wounds in camp hospitals exposed German medical personnel to American advances in wound care. The liberal use of antibiotics to prevent infection, advanced surgical debridement techniques, and systematic approach to wound documentation represented advances over German military medical practice. German medical personnel's observation and participation in American wound care protocols influenced post-war German trauma medicine, contributing to improved outcomes for civilian trauma victims. American emphasis on preventive medicine in POW camps exposed German medical personnel to different medical philosophy. Routine health screenings, vaccination programs, and health education initiatives demonstrated prevention-focused medicine's effectiveness. This approach, while not unknown in German medicine, received lower priority in German military medicine focused on battlefield trauma. Exposure to comprehensive preventive medicine programs influenced German medical personnel's post-war practice. American rehabilitation medicine for wounded soldiers impressed German medical personnel. The emphasis on returning wounded soldiers to maximum function, rather than simply pensioning them as invalids, represented a different approach to disability. German medical personnel observed physical therapy, occupational therapy, and vocational rehabilitation programs exceeding anything available in German military medicine. This exposure influenced post-war German rehabilitation medicine development. American medical communication methods, between professionals, with patients, and in documentation, differed from German practices. The emphasis on clear documentation, patient education, and interdisciplinary communication provided models for effective medical communication. German medical personnel's exposure to these communication methods influenced their post-war practice, contributing to more patient-centered and collaborative medical care in rebuilt German medicine. The experience of German POW medical personnel in American captivity demonstrates that professional identity can transcend national enmity. The American Medical Corps' treatment of captured German physicians as respected colleagues with whom they freely taught and learned different medical procedures established relationships outlasting the war. While the full extent of knowledge transfer and professional relationships remains incompletely documented, available evidence confirms German medical personnel experienced professional recognition exceeding their expectations and, in many cases, their previous experience in German military medicine. This professional treatment was not universal or without problems. Security constraints, language barriers, and the fundamental prisoner-captor relationship limited full professional integration. Some American medical personnel maintained professional distance, and some German medical personnel resisted American approaches. Nevertheless, the documented experience of German POW medical personnel in America represents a remarkable chapter in military medical history. The decision to treat enemy medical personnel as professional colleagues reflected both American adherence to international law and fundamental American medical values. The impact extended beyond individual German medical officers to influence post-war German medicine. While direct causation is difficult to establish, German medical officers who experienced American medicine in captivity contributed to post-war German medical reconstruction, bringing knowledge of American methods, ethics, and organization. The story of German POW medical personnel in America ultimately demonstrates medicine's capacity to maintain professional bonds even during war. In treating enemy medical personnel with professional respect, American military medicine not only adhered to international law, but also demonstrated values that transcended conflict. This historical example, the principle that medical professionalism transcends national boundaries, demonstrated in American treatment of German POW medical personnel, continues to guide military medical ethics and international medical cooperation. The German medical officers who experienced American collegiality rather than expected enmity returned to Germany with more than medical knowledge. They carried with them the experience that professional respect could survive even war, that medical ethics transcended ideology, and that former enemies could become colleagues in medicine's universal mission of healing.